Welcome to What She Does, the podcast that takes you inside the working lives of everyday women shaping the world around us. I'm Leanne Starr.
And I'm Annie Sinzinger. And each week, we sit down with someone who shows us not just what she does, but how and why she does it. Plus, find out if you fit the same mold to grab the same type of gig. Let's discover
What She Does, starting now.
Our guest today has spent more than 2 decades as the calm in the room when life is at its most unpredictable. Juliana Parker is a certified inpatient obstetric nurse and the founder of Nurse Core Triage, a service helping OBGYN practices deliver better patient care. She knows the delivery room from every angle, and she's here to take us inside it.
Well, today we have Juliana Parker on our show, who is a labor and delivery nurse, which I am fascinated. So, can you tell me a little bit about what your day-to-day is like? If there is a typical day-to-day?
Sure. So when I work on a labor and delivery unit, we're never really sure what we're going to get, what comes into the unit. But, usually it's a laboring mom. We will triage her and then we will help her through the process. It's a lot of education, it's a lot of reassurance. Obviously, there's a lot of anxiety with labor and delivery. People are very anxious. And so part of our job is to kind of help calm people down, reassure them, help them through contractions if needed. And I think one of the most important things that we do is reassurance and calming. Even though helping them through the labor part is important, and we obviously watch vital signs for mom and vital signs for baby to make sure they're both safe. But I think in terms of obviously safety is very important, but we also know how important it is to keep moms and babies, calm and reassured. And that's what I do in labor and delivery. And that's what led to my nurse core triage business, which is a little bit different than labor and delivery.
What is the triage business?
When I worked in labor and delivery, I usually worked night shift. And I worked with many providers who would receive calls at 2 a.m. right after they had come out of a delivery and maybe had just put their head down to try to get some sleep. And they would get a 2 a.m. call, asking, "Can I take Tylenol when I'm pregnant?" Or, "I need to make an appointment for tomorrow." Something, that was not super urgent. Or maybe they did have some valid concerns. I'm not sure I'm feeling the baby move as I did, earlier today. So what our job is we take those after hour calls for the providers and we triage the patients. So we listen to their concern. We go through a very strict protocol system that allows us to triage the patients and give them dispositions based on their answers. For example, if they're calling in for decreased fetal movement, we'll ask them several questions. And one of the questions we'll ask them is, have you done a kick count? And if they haven't, we educate them on how to do that. And if the baby doesn't pass the kick count, we ask them to call us back. And many times, almost every time, in fact, I don't get a call back, which means that the baby was active and they just, you know, maybe didn't notice the activity before.
Everything you're saying, I just am getting so stressed listening to this because I'm like, when I had my kids, it was very stressful, and that was a planned C-section. But and so there wasn't any, counting the kicks but I think I've watched too much of The Pit or ER or Grey's Anatomy or whatever, and it's incredibly stressful to watch some of the like, how close is that to reality?
Well, I have not watched The Pit. I have heard, believe it or not, Pit is a little bit too graphic for me. I
Oh,
don't like to
wow,
see a lot of
okay.
that ER
It
stuff.
is pretty
Um,
graphic, yeah.
yeah, just the broken bones and things. Like, I can handle a woman in labor,
Mm,
but I just the
ugh.
certain things I have a hard time with. But, Grey's Anatomy was not super realistic. A lot of TV shows portray moms, like their water breaks and immediately the baby's coming, or their contractions start and immediately they're writhing in pain. Like they go from like, oh, I'm having a conversation to, oh my gosh, I can't even, I can't move, I can't talk, I can't walk. Labor typically is very different. It typically starts very slowly and gradually builds over time. And I think there is a perception that you have to get to the hospital immediately when actually, there are many times, of course, with your provider approval that you might even be able to stay home for several hours before coming to the hospital, especially with your first baby, because first babies typically take a long time. The perception is a little bit off from what TV or movies like to show because they like the drama. Labor and delivery does get dramatic sometimes, and mostly towards the end of labor is when the drama will occur. But, a lot of times people, will do fine until a certain point and then they start to get more uncomfortable.
Okay, you did say drama. What what are some of the things that happen that you would consider dramatic?
Well, I think the most dramatic experiences that we have that make my heart jump when they happen is when a baby's heart rate will decline, go down into the numbers that are unsafe for extended periods of time, and that's called a fetal heart rate deceleration. And in that case, we do have to run pretty quickly to the operating room if the baby's heart rate does not recover. We try interventions first, and a lot of the times the heart rate will come back up, but we'll try interventions to bring the baby's heart rate back up. But if it doesn't recover, then we're working under a gun. Like we have to run to the operating room. We have to get the mother comfortable quickly. Sometimes that means putting her to sleep if she doesn't already have an epidural. The surgeon has, we have to prep the mom. We have to, I'm holding her hand while they're putting her under general if necessary, trying to calm her down, trying to reassure her. And it's very scary. I mean, it's scary for all of us, but I can't even imagine from a mother's perspective how scary that is for her. First, you're being told the baby's heart rate is down, and now you're being told that we have to run you back to an emergency surgery and hoping your baby's going to come out okay. So it's pretty scary. Those are the worst days on labor and delivery, I would say. For when it comes to labor. There are shoulder dystocias also, which I believe the pit has represented at least once. I did not see that episode, but I heard there was a shoulder dystocia in one of those episodes, so I can't compare it to real life, but those can be pretty scary too, and that's when a baby is having a hard time coming out. They get stuck essentially, and we have to do certain maneuvers, which again is all time sensitive, and trying not to injure the baby, trying to get it out. So there can be a lot of scary moments in labor and delivery. When I first started labor and delivery 21 years ago, I literally was terrified every day going to work. I was so scared about what was going to happen just because you don't know. But then as you start to learn and you start to become more comfortable and you start to understand that these don't happen every day, these actually are more rare than people might realize. There are definitely urgent C-sections, but not necessarily emergency C-sections. And once you start to realize that, you start to calm down a little bit and you don't go into work so anxious. And then finally, at least, after 21 years of doing this, I get to the point where I know that if an emergency happens, that I'm going to be one of the best people to have there for it because I know how to respond. I know how to respond quickly. I know how to recover a baby. I know how to move. I know the right steps to take. And once you're comfortable on a unit and you're comfortable with your team, it makes a big difference.
Okay, we had the worst day. Can you tell me like a best day on the floor? Like a triumph or
Sure, and
something that
that's a lot of days. So that that's the good thing. It's a lot of days. A good day for me is when I have a patient comes in who I am able to assist, who I'm able to get comfortable. If she wants pain medicine, I can get that done quickly for her. I can get her set up for an epidural quickly if that's what she's looking for, or if not, I can help her through the labor process and help her successfully deliver a baby. A great day for me is when a baby is born. We put the baby skin to skin with mom if possible. The baby's crying, the mom's happy, the partner's happy, and baby is healthy. And, that's a great day. And that happens a lot, which is the good news.
okay, that's a relief. Because it does seem like it's a lot of stress. Um, is that also like, you know, the decision to start your own company, was that part of it too, like, to reduce the stress on you as well?
It has been. As you get older, labor and delivery does become a little bit of a harder job. And, it's not only, emotionally taxing, but it's also physically taxing. There's a lot of twisting and turning patients and, who are pretty heavy from the epidural who can't move themselves. So it's a lot of physical work. When somebody goes to deliver, you have to lift the bottom of the bed off and move it. So there's a lot of lifting and turning and pulling and things like that. But yes, and a good part of it also, as I mentioned, was just seeing how exhausted the doctors are. And and I do give credit to OB doctors because there are a lot of doctors who will work all day in the office and then come and work all night on the delivery unit, and it can be a really busy night for them. And then they're getting calls in between that they're supposed to return. And it's exhausting for them. And so that's where we come in because we at least try to take those calls away from them. One practice can give anywhere between 1 and 10 calls a night, depending on how many doctors are in the practice. So we try to lighten their load. And then also for me, I'm very passionate about helping and educating people. And I am very passionate about trying to give reassurance and help them be a little bit calmer about the process because I have 3 kids. I know I wasn't a labor and delivery nurse with my first 2. So I know. I've been there. I know what it feels like. I remember how afraid I was. And I always try to remember that about my own experiences.
Did you always wanna be a labor and delivery nurse, or was that something that came when you went to school?
So, no, I wasn't
Oh,
really sure what type of nurse I wanted to be when I first graduated. And I knew I wanted something that was a little bit exciting. The OR piqued my interest a little bit, and I wanted to make a difference. And so I had a very good friend of mine who said, "Well, why don't you try labor and delivery? You get emergencies, you get the OR, and then you also have, just fun days." And it was a great choice for me, and I don't regret doing that. It's given me lots of opportunities through the years.
that's wonderful. So, deciding to become a nurse, when did that was that, like, in high school? Like, when did you decide to become a nurse?
No, I did not become a nurse until I was 31.
Okay.
So, it was a second career for me. Yeah, it was a second career for me. I went back to school just knowing I could probably do more and again, a very good friend of mine had just finished nursing school and she was like, "Juliana, you should do this. You would be great at it. I know that you would love it." And so she basically talked me into it and had me look into it, and I went from there.
What was your first career?
I just did administrative work in an office. I was like an office manager, and I worked for a little electrical contracting company, and I did their books and stuff. So just admin stuff, nothing nearly as exciting.
Yeah, this was a big change. What was kind of the biggest, shock to you once you landed in labor delivery?
Honestly, and I feel like when I first walked on the unit, you learn all the basics about nursing, but n- it's not until you're actually on the unit with patients that you really start learning, especially if it's a specialty area, little things that, even, we even had to learn like when moms get epidurals, dads pass out a lot or partners pass out a lot, so and how to manage that, how to recover the partner on the floor. So
That's
it's
great.
a lot of learning curve, for and even little things, like starting an IV. Like I had never started an IV on a real person. So I remember my preceptor, she was wonderful, but she really threw me in there. I kept saying, "Oh, I wanna watch one more. I wanna watch one more IV," and she's like, "Nope, you're gonna go do it yourself." She goes, "Walk in there confidently, tell them you're gonna start their IV, don't let them know that you're new, and just do it." She was really good.
God.
Now,
Um,
knowing all this, what would you tell your younger self?
Well, I would tell my younger self that there's a lot of things I would do differently, but I think that I would tell myself to focus my mind on what really matters, fill my life with positive words, the right books, people who lift you up, because that really shapes what you believe is possible. Also, I would remind myself to stay grounded in gratitude, even during difficult times. There's always something to be thankful for. And that perspective, I really feel like truly believe that changes everything for you.
Uh, That yeah, that's that was nice. You did say you have 3 kids. What how have you struck a work-life balance? Because I realized you also said part of the reason for starting clinic, you work so many nights. I was like, "Oh, that that couldn't have been easy."
Yeah. So the night shift actually made me feel like I had more time with my children. So I would go to work around 6:30 p.m., sometimes a little earlier, but I'd leave for work. I'd get there at 7 p.m. I would, be there all night, get off at 7 a.m., be home, well, 7:30 a.m., be home by 8, usually before they went to school. And so I'd get to spend that little morning time with them. And then I'd also be there when they got off the bus. So for me, that was important. To this day, I still, will work nights, and my youngest daughter plays sports on the weekends. And so there are many nights that I will work all night long, get off work, and go straight to her tournaments because I don't want to miss out on those things. And if I work day shift, I would not be able to do that. I would miss out on a lot of stuff. So I'm sleep deprived a lot of times. A lot of the parents see me and they they know she worked all night. Um, but uh, but I'm there, and then when the games are over, I go home and then I crash until my next shift.
So what are the hours like for a nurse? Like, do you like I know for a lot of first responders, it's one day on, one day off, but what is it like for a nurse?
So you typically work 3 shifts a week, and those shifts are typically 12-hour shifts. So if you're working daytime, it's 7 a.m. to 7:30 p.m. In most places, and if you're working night shift, it's 7 p.m. to 7:30 a.m. So it's kind of a long day. It's a long shift, but the bonus is that it's only 3. The downside is you usually are required to work every other weekend, so you lose a lot of weekends. I think the hardest part as a mother is that it's inconsistent. A lot of places say they do self-scheduling and you put in what you're hoping for, but it's very much by seniority. And, you know, um, if it doesn't, if it doesn't work for the unit, what you selected, they're going to make changes. They're going to make it all work for the unit, which obviously they need to. But that doesn't, you're getting your schedule maybe 2 weeks before the 6-week period. So you're kind of in limbo for a little bit there, not knowing what your schedule is gonna be. So it's a little bit of, last minute planning for your kids if they have things to do and trying to figure out transportation if you don't, if you and your partner work, or if you're a single mom or something, it can be really challenging, getting your kids to where they need to be after school for after school activities.
God.
How do you avoid burnout?
Well, use your vacation days. Um, I you know, I think that you have to love what you do, and the beautiful thing about nursing is you can move fields. You can change if you get, just like I've done. I mean, I've done labor and delivery almost my entire career, but there was a time when I was pregnant with my third that I left labor and delivery for a couple of years and did fertility nursing, which is more of a desk job because I just didn't want to be pregnant running around on the unit. And then I went back to labor and delivery. There are, at least in women's health, I don't know with other departments, I'm sure there's you know, similar opportunities. But for labor and delivery, I mean, I know that I've seen nurses do pelvic floor therapy. I've done a lot of prenatal education myself. So there was a time that I taught classes all the time, and I could do that from home. Then there's like my triage nursing that I've been doing, which I also do from home, but I get those after hour calls. That all allows me to still be at home, which is really nice because I'm around my children at that time. So finding little pockets of areas, for women's health, you can work in an OB office, you can work in for a fertility clinic, you can work for, as I said, the possible pelvic floor therapy office. There are a lot of different places you can go, and if you have a passion about something, like one of the things I love to do is help women with breastfeeding. And if I really wanted to, I could transition into a lactation consultant. If I'd have to take a test, but I could focus on that. So there are places to go if you get really burned out of one place.
That's really nice to have that flexibility too with the knowledge you have.
Yeah, yeah, and I know that my daughter, my oldest daughter is a cardiac nurse now. So she's been at a hospital for a little over a year, yeah, and so she's getting she's getting grounded. I don't know if that's where she'll stay. She had at one time expressed interest in labor and delivery, but I had recommended that she get grounded in a very strong foundation before she went to labor and delivery or any other unit, which is, what she's doing right now. Nurse who can do travel nursing, especially like my daughter who's, young and doesn't have any commitments or children at the time, she could go all over the country and nurse if she wanted to, which is one of the nice things about nursing as well.
You also said you were pregnant when you were a nurse, which I just seems terrible to me. Swollen feet and all the things that come with pregnancy, and then having to be a nurse. Um, did they make any sort of adjustments for you while you're pregnant, or they're just like, do the job?
Well, in my case, I had stepped away from labor and delivery, the floor nursing to do more of a desk job, but I can tell you that I've had coworkers who are pregnant and no, not really. I mean, those the nurses are really doing the job and I mean, it's really about the team that you have. If you have a supportive team, then a lot of your teammates will jump in and try to help you because they know that you're pregnant and they don't want you to lift or do certain things, so they do try to take some of that load off of you. And that's built on the relationships that you build on the unit with your teammates. And so if you're able to build those great relationships, you'll have a lot of people who will try to help you. But the job doesn't change if you're pregnant or not pregnant.
Yeah, you did mention the lifting and sort of the physical aspect of the job, which I don't think anyone thinks about that. But being a nurse, I think in any department is going to be physical. It's going to be everyone talks about nurses are the ones who run the hospital. So I'm I'm not surprised that they don't make adjustments. But
Juliana, what do you think are the top skills that are needed to be a good nurse?
I think that you have to know how to prioritize. That's really, really important to know what can be like maybe pushed back a little and what needs to take priority. Organizational skills, multitasking, good communication skills with people, and patience. You really need to be patient with people. There is at least in my field, there's a lot of anxiety. I'm sure there are in other areas of the hospital as well. And trying not to get frustrated with that anxiety, but be compassionate and understanding is very important as well.
and I was also wondering, like, is I don't know if that was on your agenda to be promoted, but is that something that you would have to have certain skills to get a promotion?
So, in as a bedside nurse, the next step is being a charge nurse, which usually, if you have a lot of the skills, that they will ask you to be a charge nurse, especially if you have those organizational and prioritizing skills. So I was a charge nurse for many of my years at the hospital. Um, and that's sort of your in-house promotion. Some hospitals will offer career ladders, to go up a little bit further, um, where you'll do more like staff presentations or projects, things like that. But overall, your bedside, your charge, or you're kind of on the admin team. So if you wanna go into the management part of the hospital, it's very different than what you're doing on the floor.
And I was just thinking, as you said, the men passing out, and what is sort of the most difficult aspect of dealing with patients?
There are some patients who are very demanding, who kind of think of you as a little bit of a servant to them rather than that you're there, like, watching and monitoring them and their baby, who will maybe get upset with you if you don't respond quickly enough. Some patients don't understand that when an emergency happens on our unit, like everybody jumps in. It's not just that nurse. We're all going to try to help get this baby out safely. And sometimes when emergencies happen, I've had a partner come out of their room and, get mad because I didn't bring a towel quick enough because she was getting wet from her water breaking. And obviously you can't share patient information. So I just had to say, I'm sorry, there's an emergency going on. And He was very upset. And he was like, "Well, she's wet." And, in my head, I'm thinking, "Oh my gosh, that is nothing compared to what's happening to this other patient who is in an emergency situation." So that can be a little frustrating with patients when they don't understand or they're so demanding. And, you know, um, in labor and delivery, we're pretty good about responding to call lights quickly because it could be a baby coming out. So we jump on that really fast. I know that other units, like my daughter has described, where, you know, they just hit the call light left and right for things, and she's trying to tend to her other patients, and she keeps getting called back to one room because they need a glass of water or they need their purse brought to them or they need, so she has told me some stories about that, which, for her, she has a bigger patient load. We have in labor and delivery, we're not supposed to have more than two moms or two babies at a time. But for her, she has 4, sometimes 5 patients, and she's trying to pass out the meds and, do her assessments and do all the things that are required of her. And you have people just pushing their call light because, "I need a cup of ice," and then push it again 5 minutes later because she didn't get in there fast enough, and it just, that can be very frustrating as a nurse.
Yes. I would think so.
I was going to
I
ask, what do you see as some of the challenges in the nursing field today that anyone should be aware of?
I believe staffing is gonna be a big one. The problem with nursing is a lot of places are understaffed. So you're getting heavier assignments, which creates burnout a little bit faster. If you have a really hard shift, you're coming back the next day, you're hoping to get a better shift. If you get 2 hard shifts in a row, I wouldn't be surprised if a nurse calls out on the 3rd shift. It can be very difficult and you can get burnout. And then people are calling out. And then, of course, that creates a deficit for all the other nurses on the unit that night. It it can be really challenging staffing. I know that A1 is working hard to try to promote the nurse to patient ratios, and it's recommended by A1 certain standards, but it's not always followed in the hospitals. And so staffing can be a real detriment to a unit if it's not staffed properly. And people leave, they don't always stay. If they feel like they're frustrated in one place, they might go to another place hoping the grass is going to be greener somewhere else. But honestly, it's usually not greener anywhere else. It's usually the same. Um, and it's really the people who make your experience in nursing. If you have a good crew and a good unit, I always encourage people to stay because you don't find that everywhere. So
and
it's nice.
this is kind of a toss backwards, but, what was it like to be a labor and delivery nurse during COVID?
That was hard. It was hard. I know that, I absolutely respect ICU nurses and the nurses who had to encounter it a lot more. We didn't have as many COVID positive patients, which was nice just because they obviously were trying to isolate themselves as much as possible. But when we did, we had to, put on our gear. And when you're pushing with a mom who's pushing for 2 or 3 hours straight and you're in that gown and that mask and that hat and everything, you're covered from head to toe. I mean, it is hot. And then when the baby's born, you don't leave the bedside for another hour, so you're talking about possibly 3 to 4 hours of being dressed in this gear without a break. So that was really hard. You just left there a sweaty mess. So all you wanted to do was go get in a shower. So as I mentioned, labor and delivery were pretty responsive to the call lights because, we have to go in and see what's going on. So, every time we had a call light, we had to run and throw on gear. I think the hardest part about it as well was the learning curve with COVID and, just trying to figure out what was safe for the nurses and the staff, especially at the beginning. I remember at one point in a hospital that I worked at, they took out all of the ambu bags, which are the bags that help patients breathe if they're not breathing. And I did have a mother, who needed CPR, and I was doing compressions, and no one could find a bag in the room because they had removed them all because they thought that if they gave somebody breast, it would aerosolize the room with COVID. And so trying to stay calm, I kept saying, "We need an ambu bag in here. Somebody needs to find one." And they did finally find one, thankfully, but even a few seconds can be scary without having that in the room. So there was a lot of changes with COVID that I think looking back now, they probably shouldn't have removed all those bags from the rooms. There was just such a learning curve, and I know that they were trying to protect the staff, but at the same time, these patients were in life and death situations sometimes, and, we have to be ready for all of that.
So I'm taking it in a depressing direction, but, I'm sort of fixated and Annie will ask a question after this that'll be something that's picker upper, I'm sure. But, I was talking about all the television shows that, um, have dealt on labor and delivery, and there was an episode of ER that was extremely sad and stressful, but it sticks with me, and this is many years ago now, but, the woman died after she delivered, and I just wondered, is that something that you've encountered, or was that just something that was on TV?
I personally have never taken care of a mom who's passed, but yes, I have been on the unit when moms have passed. It's not often, and that is one of the most upsetting things that, I mean, I have stories I could tell you that are just would make you just sob. Very, very sad when a mother passes. I mean, it's obviously very sad when a baby passes as well, don't get me wrong, but it's more expected sometimes that that can happen compared to a mom. Um, a lot of times when babies pass, it's it's something they found out at an OB appointment that there was no
Mhm.
longer a heartbeat and they're coming in to deliver that baby, which is also very sad and very hard for people. But when a mom passed, it's usually completely unexpected. It's something that went wrong, whether it was an amniotic fluid emboli or, but it's really shocking when a mom passes, and it's very sad. And so, yes, that's that's probably one of the hardest things in labor and delivery. Thankfully, I mean, I could count on one hand how many times that's happened in 21 years for me. So it's not something that occurs often. It's definitely, few and far between. But when it happens, it's pretty shocking for the unit for a while. We have to kind of get past that and try to recover and try not to be terrified to take care of the next patient, and every experience teaches you something. When something happens with one patient, good or bad, it teaches you what to be on the lookout for the next one. I mean, I even something simple like when I first started doing labor and delivery, I was a brand new nurse. I'm taking care of a patient. Her baby goes into a heart rate and or a heart rate deceleration, and the doctor says we have to run back for a stat C-section. And we start to run, but all of my cords, all the electronic fetal monitoring cords are tangled because I didn't untangle them. And it took us like 2 minutes to kind of unwrap them from the IV and unwrap them here and get them untied and get it, that never happened again, I can tell you that. Every time I took care of a patient, the first thing I did was follow every single line that was attached to that patient and made sure they were clear and able for me to easily rip out and run. So, every experience teaches you something. And, as you get seasoned, you start to learn these things and then you hope to pass them on to the younger nurses. So, whenever I oriented somebody, that was one thing I always said never let your lines get tangled. In an emergency, you want to make sure you can pull and run, and so you just hope that your experienced nurses continue to pass some of these lessons on to the younger nurses.
That's more optimistic and better story than I was
Great
expecting.
advice, though. Great advice. I think my last question is really something we ask all the time, which is how technology impacts your job, whether that's the use of AI or other technological advances that
Labor and
impact.
delivery robot.
Yeah. Is there a labor and delivery robot coming for the obstetrician and labor and
My
delivery
gosh.
nurse job?
Can't imagine. I don't think that is one job that will ever be replaced with robots. But, I think that there's a lot of Googling by parents, which can instill a lot of fear. That's definitely something we encounter a lot of, Google told me this. And you're like, okay. And we're trying to talk them off the ledge a little bit, saying, okay, that's like worst case scenario, which doesn't usually happen. So I think in the age of AI, that might continue with people putting a lot of information into AI, and sometimes you mentioned how I was a labor and delivery nurse with when I had my third child, and I think one of the downsides of being a labor and delivery nurse when you're pregnant is knowing what can go wrong. And when I was in labor, I watched everything so carefully. So sometimes too much information is not great, right? So I think sometimes if you have questions, rather than going down the Google hole, is to contact your provider and go through them because they're going to give you a more realistic explanation rather than every single possible horrible thing that can happen and more of the realistic expectation of whatever symptom you're having.
Well, I think that's probably a good place to end, but thank you so much, Juliana. It was great to talk to you.
You're welcome. Thank you for having me. I really appreciate it.
So let's talk about nursing.
What do you wanna talk about nursing?
um,
What do
so
you wanna talk about that we just learned from Juliana?
yeah, I know. What's interesting to me is you have to and I knew that you have to do a lot of training to become a nurse, but there's like,
Mhm.
it doesn't end with schooling. You keep going, and there's more tests and more things you have to take.
Well, I think it's based on also what you specialize in, and there's ongoing learning in general because things are always changing in terms of care, new technology, new procedures. But I think the one thing that doesn't change is necessarily how you deal with patients.
Yeah.
Like, you will still learn how to deal with different types of patients, but in her case with labor and delivery, and we have a little bit of experience with being in labor and deliver in the labor and delivery room,
Yeah.
but I would say that just hearing from her viewpoint about what is involved and just in terms of just education, but also the on-the-job training that happens and all the different things you have to deal with is really sort of daunting to me
Yeah.
because I, at one point, thought about being a doctor. And now whenever I listen to our guests who are in the medical field,
Medical professionals, yeah.
I am so glad I'm not one because I don't have the dedication
Yeah.
that it takes, and I also thought I was okay with blood and other types of discharge, but I don't think I would be in this case,
Yeah.
and in particular because of everything that happens when you birth a baby. So, one thing, we didn't ask about was
Yeah. So and okay, I'm laughing too much. But one thing that was a burning question for me because I had just seen a female comedian she was talking to people in the audience, and one of the people was a labor and delivery nurse. And so she asked, because I guess a friend of her told her this, everyone poops when they're giving birth.
well, when they're giving a natural vaginal birth.
Natural,
Yes.
yes. Hopefully, we don't poop during a C-section, but we wouldn't know
Yeah,
anyway.
we don't know, yeah.
We have no idea. But, and she said, "Yes, everyone poops." And so I had to ask, uh, "Does everyone poop?" And her answer was 50% of people poop. 50% of
Yeah,
women poop.
but they don't tell you that,
Yeah,
They're trying to be nice because obviously it's a very vulnerable time for
yeah,
women. You're completely exposed in ways that you never thought, whether it's C-section or otherwise, and so
right.
the last thing you wanna know is you
That
also
you pooped.
defecated while you were giving birth, Like,
Yeah,
that is a
layer of
definite
humiliation that you don't
yeah,
need.
but it's nice to know that they got your back and your front and
Oh
everything
my god.
else.
And apparently they will not tell you. They'll
Yeah,
just clean it
so
up and be like, "Oh, no, you're fine." And that it's good to poop because that means that you're pushing hard enough and the baby is coming out.
right, exactly. So it is a good thing for that to happen, and so no one should really be that
No one should be embarrassed,
no.
but, it's an extra level of yuck. that
that they have to deal with. So
yeah.
let's talk a little bit about like the amount of different skill sets. So clearly emotional intelligence is a big part of it. But she also talked about ability to respond quickly in high pressure situations.
Yes,
So
like
what happens
keeping the
when
cord
something goes
unhanged.
wrong?
Ugh,
Yeah. I
yeah.
mean, you have to really somewhat have a strong stomach.
You have to have a strong stomach and also just be ready for bad news and having to deliver bad news, and it doesn't happen all that often, but it happens.
Yes.
And
So luckily it's a rarity that those things
yes,
happen, whether it's infant based or mother based, but ultimately it can also wear you down. I think that when you're thinking about an opportunity in the medical field and you choose something like labor and delivery nursing, she
yeah.
talked a lot about how also rewarding it is.
Yeah, there's a lot of good news. Like, "Here's your baby." That's nice to say, and and also the husband's passing out, I think it's funny.
It is funny. I was surprised my husband didn't. So,
Yeah.
in the delivery room, but there are cases where those are things that maybe they don't tell you when you're starting out as a labor and delivery nurse that
Yeah.
partners may pass out, and then how do you lift them? She did also talk a lot about how
The
physically
physical
demanding.
aspect, yeah.
Yeah, the physically demanding the job is because, women are getting their epidurals if they have them, which
You
means
have
they
to
can't
lift them.
move, they can't feel anything, so
Yeah,
you have to help lift, the bodies and
and
so
they are bigger than usual.
yes. I mean,
Yeah,
you figure like anywhere from an extra 10 to 20 pounds of person to have to lift before the baby comes out. So, but there's also the after when you've had the baby and you need help getting out of bed and stuff like that. They
yes.
do that too. And the shifts are long, 12
Yeah,
hour
they're
shifts.
super long. The good news is they're compensated pretty well.
Yeah.
I think nurses should be paid more than they're getting paid anyhow.
Yeah.
It's a
Yeah.
good salary.
Well, here's the interesting news from Bureau of Labor Statistics, a general RN. So we couldn't find specifically about labor and delivery, but a general registered nurse, which is what a labor and delivery specialist nurse is initially. Median pay is 94,000 annually. And then if you are a traveling nurse, so that
Yeah,
was probably the good thing about being a nurse is you can travel, it's flexible, you
yeah.
can get paid a lot more. So you can start seeing averages of 100K plus, and you
And
get to
that was
travel places.
a big deal during COVID, traveling
Yes.
nurses.
Yes. I mean, when you think about, wow,
Yeah.
shortages of healthcare workers and then the ability to travel from place to place to offer services where they need them, it was, I'm sure, very helpful in places that didn't have them. But in general, there's a shortage of nurses.
Yeah.
We need nurses. It's a
Yeah.
5% growth through 2034, which is actually higher than most other jobs.
Yeah. I'm surprised it isn't a bigger demand,
I
but
know, I would think so too. I mean, there's what, 3 over 3,000,000 nurses, but that's still not enough. And then the Bureau of Labor Statistics is saying that there's about 180,000 openings projected each year
whew,
on average.
wow. We need more nurses. Give them more money.
Well, there's also a lot of places you can work, but I mean, 59% of the work environments are actually in hospitals, and those are state, local, and private. But then there's ambulatory care. There's also educational places, um, and then obviously travel. You could
Yeah.
travel to different places to do that work. But I think that to be a nurse, you probably have to have very specific qualities
Mhm.
or attributes. So in this case, I wouldn't necessarily say extroverted or introverted, although I'm sure extroversion helps.
Yeah.
But you
I
really
don't
need
think
to be calm.
yes, calm is more important, I think, than extroverted or introverted. Just
Absolutely.
not freaking out. It's important.
Yes,
Um,
that kinda helps. I think Juliana also spoke about the fact that, you need to be able to respond quickly and switch gears when the situation needs or calls for it. I think also this idea that you can carry the emotional weight of the job and be resilient and not be mean.
yeah, yeah. So I think, it was interesting to find out what the demands of nursing were. Um, it seems like a lot.
It seems like a lot, but let's get some more nurses, man. We could really use them. Thanks for joining us today. That's what she does, and maybe what you could do too. If you like what you heard, make sure you follow What She Does wherever you get your podcasts.